Good everyone, welcome back to the Visual Medic. Today we're having another insightful episode, and I'm together with my colleague in medical training, in the person of Hikmat Kareem. So thank you for having you in my session today.
Thank you. My name is Hikmat Kareem.
Nice.
I'm a final level medical student.
Okay.
I serve in a lot of capacities,
Okay.
and I'm vice president for the Southwest Medical Student Association.
Capacity.
Also, the editor-in-chief of the Udum Trial team,
Okay.
and I'm the licensing officer to the NIMSA office
Wow.
on medical women of the Medical Women Association of Nigeria
Wow.
for Udut here
Wow.
as well.
Fantastic.
So I'm also the editor-in-chief for the Still Mental Health
Okay.
organization
Capacity.
for mental health.
Capacity.
But for here, I think I prefer the licensing officer for M1.
Oh,
That's how I share my advocacy journey
okay.
on health-related issues most closely.
Okay, that's a brief one. Thank you for honoring our invite.
Thank you for having me.
Today, I want us to discuss a very important topic that is taking a lot of lives of women. We need to keep creating more awareness about that particular topic. And what's that? I want us to discuss about breast cancer and probably part of fibroadenoma. I know in Visual Medic, we see it as our responsibility to simplify health, to simplify medicine to the most understandable level. To the point that our audience, they don't need to come to the hospital before they understand the topic. They don't need to study medicine before they understand medicine. So we simplify health to the simplest form that people will understand. So what can you briefly tell us about breast cancer? Can you have a very brief introduction about breast cancer?
All right. So I'll try to use little to no medical jargon.
Okay, thank you for
For
that.
breast cancer, I'll start from what exactly is cancer. People hear cancer, but most likely when it comes to the hospital, you hear malignancies.
Exactly.
You hear malignancies. So cancer, we have every living human being goes through the 7 basic process: movement, reproduction, excretion, growth, and then ultimately, when all these processes stop, they're supposed to die. Every living cell. But then, when these cells do not die, when they don't receive the signal of it's time for you to stop growing, there's a continuous uncontrolled growth. Basically, they're not receiving a signal of, they're receiving the signal, but they're not taking the signal of stop growing. That's cancer. There's uncontrollable growth. So something that's supposed to not expand beyond a level keeps growing, and it just becomes detrimental to the person's health. That's cancer.
Okay.
Now, breast cancer is this continued uncontrolled growth in the breast tissue. That's how basically I can explain it in layman terms. It's uncontrolled growth of the cells due to not receiving the signals. But this is happening in the breast. It can happen in various other parts of the body, but specifically breast cancer. They're just not receiving the signal. So they keep growing, and that's a brief summary of breast cancer.
Yeah, thank you for that. That's so much elaborate. How common is this breast cancer in society, or let me say in the whole world at large?
Okay, in the whole world, we have 1 in 7 women. 1 in 7 women at risk of breast cancer. However, in resource-poor countries, these are developing countries, 1 in 28 women.
Okay.
1 in 28 women in resource-poor
1
countries.
in 28 women. Wow.
In resource-poor countries are at risk of developing breast cancer. This is according to textbooks.
Oh.
We are evolving, so there's more data, obviously. So that's basically it. And it's not just women, even men are at risk of breast cancer. So it's not just women. Men are at risk of it. It leads to a lot of death. And why it leads to a lot of death is because of late detection. And I believe that's the purpose of this.
Yeah. Thank you very much for that. And you said 1 in 28 women. And me, I cannot say according to textbook, because I did my surgery posting, my recent surgery posting at general surgery. At every clinic day like this, you have like first 10 female patients, we have 3 cases of breast cancer. So if I want to see, I may say like 3 in 10 because it's very serious and common disease like that. So what are the likely risk factor, or what are the causes of this breast cancer?
Okay, so cause, we can't say cause, we say risk factor. What we mean by risk factors are these are the things that increase your chances of having breast cancer. And I'll divide them into modifiable and non-modifiable.
Okay.
Modifiable, these are the things you can't change. You absolutely cannot change them.
Okay.
Non-modifiable, I mean, you can't change them. Then modifiable, you can decide to eat healthy, and this can reduce the risk factors. You can reduce the chances of having them. You should also note that whether you have the unmodifiable risk factor or you have the modifiable risk factor where you can change it, still you could have breast cancer.
Okay.
It could just come like that. The word is sporadic. You can just have it despite not having both modifiable and unmodifiable risk factors. So the key to it is early detection. So I'll start from the non-modifiable risk factors.
Okay, thank you for that.
These are the ones you can't change. First, your age.
Okay.
You can't change your age. It's higher in women of elderly age, middle to elderly. We're talking greater than 40 years of age, 40 to 49, greater than 60 in developed countries. We're talking about sex. A woman is at way higher risk than a man. We have genetic predisposition. We have the BRCA1 and BRCA2. This is, if you have this gene, you have higher risk of getting breast cancer. We have hormones, exposure to hormones. We have something called menarche, which is the first period as a woman. And menopause, which is menopause. Some people know menopause, but most people don't know menarche. So menopause is your last period as a woman, but the menarche is the first ever period you've had as a woman. So if you're having this at less than 12 years, that means you're having early menarche. If you're having menopause greater than 55 years, you're having late menopause. So if you're having early menarche, late menopause, you're having higher risk. You're having higher exposure to estrogen. And by having higher exposure to estrogen, this hormone is going to increase the cell. It's going to make it grow more and more and more. So this is one of the, you can't choose when your period starts.
Definitely.
But you can't choose when it goes. So these are why it falls under the non-modifiable risk factors of breast cancer. We also have ethnicity. You find it more in Caucasians, but now you find that we have it even more in the black race, African Americans. These are some of the non-modifiable risk factors. Also, now move on to the modifiable risk factors. For the modifiable risk factors, we have obesity.
Something you can modify, you can adjust.
You can change, something you can just do something about it to reduce.
You can control within your control.
But the modifiable risk factors start from obesity. These are the things within your control, like you rightly said. These are things you can change. Obesity is when your BMI, how do you know if you're obese? You check your BMI. How do you check your BMI? Your BMI is your weight over your height. It's the power of 2. So we should all know whether we are obese or not. The BMI is not a complete assessment of obesity, but it's good enough. Then we also want to know about modifiable risk factors: alcohol consumption, cigarette smoking. We have something called hormone replacement therapy. That's also part. And then we have estrogen containing pills. These are, how do I put them? Birth control. Contraceptives, yes. But particularly the ones that contain estrogen. For greater than 5 years, if you're using these contents for greater than 5 years, this increases your risk of getting breast cancer. Now, nulliparous women. When they say somebody is nulliparous, that means they've not given birth to any offspring at all. So that's nulliparous. Nulliparous women, and also women that have not breastfed. Breastfeeding is a very important aspect because it protects both the mother and the child. How does breastfeeding now reduce the risk of breast cancer in this case? We're talking about exposure to estrogen. When a woman is breastfeeding, there's less estrogen. So even if the cell wants to grow, it doesn't have the estrogen that's supposed to be upping it to, get bigger, grow. It doesn't have it at the time of breastfeeding. So age of first child. Age that you have your first child is also one of it. These are the questions that when you come to the hospital, they'll ask you. I feel a little bit intrusive, but this is to ascertain and ask for all the risk factors and cover all the bases to be able to give you definitive treatment. Those are some. There's unmodifiable risk factors: eating healthy, having your vegetables and fruits, all those. These are things you can modify. So that's basically.
So which means diet is also part of the Bible.
Yes.
What about the exposure to radiation?
Yes, there's also that. Thank you. For radiation, this is when it comes to you, like, do you take a lot of X-rays? Are you a radiographer? Do you stay in the X-ray, CT scan sweet a lot.
Oh,
All that. I can't exactly exhaust modifiable. All modifiable you can exhaust it a bit, but modifiable you can't, because there's so many things in our lifestyle you can change.
okay. Thank you so much for that.
Yeah.
That's so insightful. So this breast cancer, is it curable? Is it something that it can totally cure, or that can disappear at any point of the time?
To answer that question, I would say early detection.
Okay.
That's why we are advocating for self-breast examination.
Okay.
Early detection means the moment you discover a lump, you get vision.
What is lump?
Lump. So it's a swelling. Swelling. If something is above where it's supposed to be normally, swelling.
Okay.
Swelling, yes. Swelling.
Yeah, thank you for that. You know, you are talking to me.
I try to listen to know medical jargon.
Yeah, thank you for that.
So when you discover a swelling, something round, something that's not supposed to be there in your breast, you go straight to the physician, and then they do something fast. They can do something better because they're staging of cancer. So once it's the first time you notice it is like when it comes up, you have higher chances of them eradicating it.
Okay.
It's not exactly, I won't say cure, but there are higher chances of eradicating it.
Okay.
The treatment would go way better than if you're detecting the swelling late, you're saying, hey, you do something at home rather than actually take proper treatment.
Okay, thank you for that. And even with that your response, that will lead me to this particular question. What are the likely red flags that an individual will look up to, or that if you see, you should quickly rush to the hospital to present that particular symptoms?
Okay, so for this, we have a swelling, which I call a lump.
Okay.
I'm checking swelling.
Swelling at where?
In the breast.
Okay.
In the breast. Swelling in the breast, in the supraclavicular area, which is the clavicle.
Okay.
The armpit, which is axillary region.
Okay.
The armpit, the clavicle, and the breast.
Okay.
These are any swelling, something round, something small, painful or painless. Painful versus painless.
Okay.
Cancer is mostly not painless.
Okay.
It's not mostly, it is not painless. That lump that you see, it doesn't cause anything. But if it's not, you will feel pain. It will be mobile. We call it a mouse. Like it moves around a lot. So when I did general surgery posting, so during that period, the scenario will say, is it a mouse? Meaning that is it something that moves? It's very mobile. That is something that is benign. When we say benign, that means it's not a cancer.
Okay.
So in this case, it's a fibroadenoma. It's not cancer. This is a swelling that is moving all around. But a swelling that is cancer, or likely to be cancer, would not move.
Okay.
It would be painless. But for the one that is not cancer, it would move and it will be painful.
Okay.
That's just something you can use as a guide, but the proper thing is to seek physician
consultation. Yeah, that's a brilliant one. I like your response, honestly, because you don't only answer the symptoms that everyone asked. You talk about the difference between fibroadenoma and the breast cancer. I really love that. Thank you for that. We are blessed to have you today. You talk about safe breast examination. I don't have an explanation.
So I have 3 questions on self-breast examination.
Okay.
Why?
Okay.
Why should you do it?
Okay.
When should you do it? And how should you do it?
Okay.
You can learn it, but you might not know why you're doing it.
Okay.
You can know why you're doing it, but you might not know when to do it. Okay. So these 3 things are important. Why are you doing it? You're doing it to be able to you want to know very early that something is wrong. There's a swelling that's not supposed to be there. There's changes in my skin. Skin above, around the breast region that's not supposed to be there. There's discharge. Something is coming out from the breast that's not supposed to be there. That's why you're doing it.
Okay.
You want to know if something is wrong.
Okay.
Early.
Okay.
That's why. Now,
okay.
When should you do it? For premenopausal, this is anybody that hasn't attained menopause. Everybody that is still having their periods.
Okay.
Premenopausal, before you stop having your period. That's what it means. So for anybody that is still having their period, they're supposed to have or do this self-breast examination 5 to 7 days after your period. So it's not something that you do during your period and claim that you say long.
Yeah.
No. Do it 5 to 7 days after your period. You might not ask, what about me that I'm not doing my period again? How do I so you keep track.
Okay.
If you do it on the 15th of this month, you make sure you do it on the 15th the next month.
Okay.
Or around 13th, 14th, 15th. Just something consistent.
Okay.
Basically. So that's when you should do it 7 days after your period. For postmenopausal women that are not having their period anymore, this should be consistent. Same period every month. Every woman should do a self-breast examination 12 times in a year, because you have 12 months in a year.
Yeah, that's correct.
That's right. So that's when. Now, how? We talk about why, when. Now, I'm talking about the main thing, which is how should
and
you
how
should you do it? You should first get the mirror. Now, when I say this part, I always say, I'm not saying go and buy mirror because you want to do self-breast examination.
Okay.
Most houses have windows now, and they are see-through where you can see it.
Oh, that's correct. That's correct.
So you don't need to incur unnecessary expenses, so to say, because you want to do self-breast examination. So we have.
But even if you go to that extent, it's something that worth it.
It's very worth it. So you need to have a reflective surface.
Definitely.
To check what are you doing. You're putting your hands behind your side, like by your side, like on your waist. Sorry, you're putting your hands on your waist. That's the first step.
Okay.
Putting your hands on your waist, and once you do that, what are you checking for?
Okay.
You're checking for if there's one breast hanging lower than the other, one breast hanging higher than the other.
Okay.
This is to check for attachment to the chest wall. In this same case, you're checking for, is there any skin changes? You know how an orange looks like unpeeled, an unpeeled orange.
Yeah.
So the skin of around the breast or on the breast shouldn't look like that. Putting your hands by your sides, which is at your waist. You're checking for changes in the skin, over the skin around the breast. You're checking if one is hanging higher, one is up or down. You're checking if it's pendulous. When we say pendulous, is it swinging or is it not moving at all?
Okay.
Swing pendulous meaning you're checking if it's swingy or is not moving at all. That's the first thing you're checking. Now you can do this in 2 ways. You can do it while standing up or lying flat.
Okay.
You can lie down and you can stand up.
Okay.
So when you stand up and lie down, it's still the same technique, but you can just choose how to do it.
Okay.
So that's what I'm saying, is the same procedures for the next things I'm going to say. You want to put your hand where you're checking. If you're checking the right hand side, you want to put your hand of the right hand side that you're checking behind your neck, on top of your head and your back. This hand, I'm checking the right side. This hand is behind my neck or on top of my head.
Okay.
Now you're checking with the opposite hand. They're checking the breast tissue of the right hand with the left, of the right breast with the left hand.
Oh.
You get what I'm saying?
Yeah.
So if it's for the left breast, they're checking with the right hand. And you're using the flat. Okay, let me show this. The flat of your fingers. Not the palm. Flat of your fingers.
Okay.
Using the flat of your fingers, you're going in circular motion around the breast. You're going, and you're going to press a little bit firmly. Why you're pressing firmly is to avoid feeling false lumps.
Okay.
You're not just going tender, and you're not also inflicting pain. You're just going softly, and also checking for any. What you're checking for now, you're checking for any swelling. Swelling meaning a lump. I don't know how better to say swelling.
Yeah, I think swelling is the best. Yes,
right. You're checking for any swelling. So the next thing now is when you're checking, we already talked about where you're positioning for the right hand. When you're checking for the right breast, your right hand is behind your neck or on top of your head. You're checking with the flat of your fingers, not the palm. Flat.
Okay.
Circular motion. You're pressing a bit, not too soft because you don't want to feel false lumps. So I'm going in circular motion with the flat of your fingers on the corresponding breast that you're checking. So you're doing that, and then you're checking for any swelling. Checking for any swelling at all. That's for the breast tissue that you're checking for. You do this for both sides. Once you're done doing this for both sides, you feel the clavicle, the supraclavicular area. The clavicle, how do I call it in layman? Collarbone.
Collarbone, yeah.
Yes, collarbone.
The one that you see.
Yes. You're checking right above it for any swelling. Then you're checking the axilla, armpit. You're checking the armpit. When I say checking the armpit, it's not that you know when people shave, there can be like small bumps, not bumps. You're checking in, like you're putting your hands in. You're feeling inside to see if there's any swelling in the armpit. So after you have checked breast tissue, a self-breast examination is not complete without checking for swelling in the collarbone area and in the armpit area. Because sometimes the swelling can start from there. It doesn't necessarily have to start
from the breast.
We have the suspension ligament in the axilla, in the armpit as well. So it doesn't have to start from the breast before you say it's swelling. Swelling can start from the axilla, it can start from the clavicular region, the collarbone, the armpit. It can start from the armpit, and then it can also start from the collarbone. So that's why a self-breast examination is not complete until you've checked for swelling in any of these places. It can also start from the axilla in form of a wound. You're just seeing a wound, and then you're wondering, it cannot be affecting the breast. But you should also remember that each part of the body is linked. Every part of the body is linked, right? So the next thing after you've done this is you want to gently press on the breast to check if there's any nipple discharge. Unless you're lactating, meaning unless you're breastfeeding, there shouldn't be any form of discharge from the nipple. You are not supposed to see red. You're not supposed to see green. You're not supposed to see milky. If you're not, the only color you should see, even when you're breastfeeding, is the actual milk that's coming out. So you're checking for that. The nipple discharge is also a sign that you should look out for. It's not that you see it and then you ignore it. No, it's a early detection sign of something is wrong. I should confirm if it's something that is big or small. Now, once you're done with that, you smile. I say, good, I've done my self-breast examination for today.
I clap for yourself.
And then you're happy that you've done for the month, and then you look forward to the next 11 months, because you should do it 12 times in a year, because we have 12 months in a year, 5 to 7 days after your period. If you're not on your period anymore, consistent. And also, it's not even only postmenopausal women that are not on their period. We have women with gynecological issues, maybe endometriosis, all those things that they are not having their periods. They can still do a self-breast examination. They're not limited by whether you're having a period or you're not to do a self-breast examination. There's no excuse to not do a self-breast examination unless you don't have a breast. Unless you don't have a breast. That's when you don't do a self-breast examination.
Thank you very much for that. Thank you very much for that. So what about the people that are already at their menopause age? So we talk about the cyclical change for the people that are still menstruating. So at what point of a month that you can
choose any time. So long as they're consistent about it. If you're doing it on the 1st of this month or 2nd of this month, 3rd of this month, you should do it 1st, 2nd, 3rd of the next month. You can put it in your calendar. You can tell your children, if you don't have kids, you can tell your partner, you can tell anybody around you to remind you. You can set a reminder on your calendar that I need to do a self-breast examination. It should always be at the back of our mind. It should be a lifestyle. Same way we eat. We should do a self-breast examination, because early detection really is very important.
Thank you very much for that. So which means an individual that is watching this video has like 3 responsibilities. Number 1 is self-breast examination.
They have to do it.
You have to do it every month. Number two is to subscribe to our channel for more insightful and educative videos like this. Number 3 is to share these videos with your loved ones. Number 4 is to comment, to like and share with your loved ones, because it is their responsibility. As social media, it is we also see it as our responsibility to simplify medicine. So our audience, they also have the responsibility of sharing it, subscribing to our channel, so that anytime we have discussion like this, they will easily see the notification at their head. So what can you tell our audience?
The Vision Medic has made this very easy, because you find that when you ask an elderly woman, for example, about have you ever heard of self-breast examination? They don't know, but you find them a lot on their phones. These are channels that they should subscribe to, because they are always on their phone.
You give us 5 stars.
Yes. Okay. So when they see this video, they're like, something like this exists. They don't just stop at that. They share it to, once you're done, you share it to WhatsApp groups. You share it. Now this doesn't stop at women. You can be a guy and see this video. I'm like, share it to your family group, your sisters, your cousins, your nieces, your mothers, your aunts, all of them. And once you do that, not just send it and make sure that they watch it.
Definitely.
It's not just send it and make sure that they watch it, because it's very important. Any detection saves life. Any detection is equals to better outcome. And it doesn't even have to be somebody that is of age. Even the young ones, because the young ones, they should be aware now, so that they can easily detect it before it becomes over the board and becomes too late for treatment. So they should be aware. The more I have a standing theory that the more young ones are aware, because we find that younger generation, they're easy, they speak up a lot.
Yes,
so the more
yes.
young ones are aware, they'll tell mommy, have you done yourself breast examination
Exactly,
today?
exactly.
Auntie, have you done yourself breast examination this month?
Yeah,
Did this
yeah.
last month? So
Yeah, yeah.
it doesn't stop at just sharing. Make sure they also watch it.
Okay.
So you have to make sure they watch it and you have to comment, subscribe, like everything. Yes.
Thank you.
Thank you
Give
very
us 5
much.
star.
5 star.
All right, thank you. See you next.